this new measure of allowing asymptomatic healthcare workers to return to work, isn't it too risky just given that maybe there could still be transmission and isn't it just too much of a risk even at this point?
Well, I explained earlier, and I will repeat that first, we have no choice. We have to make those sort of calls, but we make them in an environment of risk management. And what does that mean? That means that we're saying that this is a best alternative compared to not providing cares to the people. And because our employees, and thanks to the vaccination, our healthcare employees are up to 98% double dose. So they already have a protection. They already have this protection. And second, we provide them all the environment of personal protection to work. So not only they are double vaccinated, and some of them right now are getting their third dose, but the CNST is finalizing their recommendation on additional equipment that should be provided to them. And we've been saying all along that the minute we have the recommendation, a clear recommendation from CNSST, will provide the additional mask that the recommendation. So this is not an easy decision, but I think it's the best decision in the circumstances.
Can we have an example of what that would actually look like? I mean, are we talking about a nurse who could potentially return to a CHSLD and then be in close proximity to patients? What is that going to look like, and how is that going to actually work?
Well, there is an order of priority that have been discussed, it's for sure, and I'll let Dr. Agruda comment on it. But there will be a guide that have been discussed with the unions in the last few days as to minimizing the risk that we take at the beginning, and depending on how the situation evolves, and we'll take more risk in certain environment. But there is a guide that have been prepared.
Yes.
And I don't know, Horacio, if you...
And if I can say, first of all, if a healthcare worker is not in good shape at all, we will not ask him to go to work. But there is people who really have some symptoms, very soft ones, who can go work again and they feel okay. We're going to put those infected persons, if they are infected, depending how many days they have been having their symptoms. They could go in certain units where there's already COVID people positive. They will, the patients are going to have a mask. They will use a mask when they're going to be near of the patient. So they're going to apply those things. And don't forget that those two persons are already sick. So it's not, the risk of transmission is not there. That person will not be able to be dining with their colleagues during lunchtime, because it's when they take away their protection and that they can eat, and that was a story of different conditions. Others will be people exposed to cases at home, a kid who will have COVID-19. The nurse can be a contact, but not a case at all. If she's only a contact of a case and has no symptoms, she will be able to go back to work. She's going to be tested at different periods to make sure that if she get the disease, that we're going to do the work. So there is a lot of conditions, and I would say also it won't be everywhere in the hospital, it won't be everywhere in the CHSLD, but it will be adapted to the reality. Because here, the thing is to balance the care we must give to people and the risk of COVID-19. And we know, first of all, if I do have an heart attack soon and I have to go to the intensive care, I want to make sure that this doctor is going to treat me, because I can die if there is no things. And I would prefer having a cardiologist or an intensivist who was infected doing good job with me than let me die from my heart disease. That's exactly the sense of that, and we won't use that for just as a normal thing. It's an exception thing. It's going to be analyzed, as my minister said, case by case, and we are going from lower risk to high risk in priorities.